राकेश अरे कुछ सेमिनार है ना। हेलो राकेश। राकेश अरे कुछ सेमिनार है ना। हेलो राकेश। राकेश अरे कुछ सेमिनार है ना।
Good afternoon, Rakesh. Good afternoon, Rakesh. Good afternoon, Rakesh. Good afternoon, Rakesh. Good afternoon, Rakesh.
Hello. 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 Hello.
Hello. Hello.
Hello.
Can you hear me?
Yes, sir.
Okay.
Hello, sir.
Yes.
Rakesh, sir. Are you getting my voice? Rakesh, sir. Hello. Hello. Rakesh, sir. Are you getting my voice?
Hello. Hello.
Hello.
Can you hear
Hello.
me?
Yes, sir.
Okay.
Hello.
Sir.
Sir.
Yes.
Rakesh, sir. Are you getting my voice? Sir, I'm not getting your voice. Rakesh, sir. Hello. Hello. Rakesh, sir. Are you getting my
Hello.
voice?
Hello.
Hello.
Can you hear
Hello.
me?
Yes, sir.
Okay.
Hello.
Sir. Yes.
Rakesh, sir. Are you getting my voice? Rakesh, sir. Are you getting my voice?
Hello. Hello. Can you hear
Hello.
me?
Yes, sir.
Okay.
Hello.
Sir. Yes.
Rakesh, sir. Are you getting my voice? Rakesh, sir. Are you getting my
Hello.
voice?
Hello.
Hello.
Can you hear
Hello.
me?
Yes, sir.
Okay.
Hello.
Sir. Yes.
Rakesh, sir. Are you getting my voice? Rakesh, sir. Are you getting my
Hello.
voice?
Hello.
Hello.
Can you hear
Hello.
me?
Yes, sir.
Adi.
Okay.
Hello.
Sir. Yes.
Rakesh, sir. Are you getting my voice? Rakesh, sir. Are you getting my voice?
Hello. Hello.
Hello.
Can you hear
Hello.
me?
Yes, sir.
Adi.
Okay.
Hello.
Yes.
Rakesh, sir. Are you getting my voice? Rakesh, sir. Are you getting my voice?
Hello. Hello.
Hello.
Can you hear
Hello.
me?
Hello.
Yes, sir.
Adi. Hello.
Yes.
Rakesh, sir. Are you getting my voice? Hello. Hello.
Can you hear me?
Hello.
Yes, sir.
Adi. Hello. 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 Hello.
Yes, sir.
Adi. Hello. 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 Hello.
Yes, sir.
Adi. Hello. 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 हेलो 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 हेलो
हेलो सर, बहुत बहुत लाइट आवाज़ आ रही है।
हेलो हेलो
हेलो।
हेलो
हाँ, आपकी
हेलो
आवाज़
राकेश सर, आपकी आवाज बहुत स्लो आ रही है। आप माइक्रोफोन हटा दीजिए, नहीं तो
सर
डायरेक्ट बात कर
बहुत
लीजिए।
लाइट आवाज़ आ रही है। धर्मेंद्र सर, आपकी आवाज़ क्लियर पहुंच गई है मेरे पास में, लेकिन सर की आवाज़ नहीं आ पा रही है मेरे पास में।
सर ऐसा करिए, सर से कहिए ये जो हेडफोन लगाए वो हटा दें।
हेलो।
हेलो
राकेश सर, हेडफोन हटा दीजिए, आप डायरेक्ट बात कर लीजिए।
हाँ,
हेलो
राकेश सर, आपकी आवाज बहुत स्लो आ रही है। आप माइक्रोफोन हटा दीजिए, नहीं तो
सर
डायरेक्ट बात कर
बहुत
लीजिए।
लाइट आवाज़ आ रही है। धर्मेंद्र सर, आपकी आवाज़ क्लियर पहुंच गई है मेरे पास में। चटर्जी सर की आवाज़ भी
लेकिन
मेरे
सर
पास
की
बिल्कुल
आवाज़
साफ
नहीं
आ
आ
रही
पा
है।
रही है मेरे
I'm
पास में।
getting चटर्जी जी
सर
voice
ऐसा करिए, सर से
clearly,
कहिए ये जो
but
हेडफोन लगाए
राकेश
वो
सर,
हटा दें।
there is some problem.
हेलो
राकेश सर, हेडफोन हटा दीजिए, आप डायरेक्ट बात कर लीजिए।
हेलो
राकेश सर, आपकी आवाज बहुत स्लो आ रही है। आप माइक्रोफोन हटा दीजिए, नहीं तो डायरेक्ट बात कर लीजिए।
जी सर। धर्मेंद्र सर, आपकी आवाज़ क्लियर हाँ सर, आपकी वॉइस नहीं हमारे पास पहुंच। चटर्जी सर की आवाज़ भी
लेकिन
मेरे
सर
पास
की आवाज़ नहीं आ पा रही है मेरे पास में।
सर ऐसा करिए, सर से कहिए ये जो हेडफोन
We are also not getting ma'am's voice.
मैम
हाँ,
पहले आप अनम्यूट कीजिए मैम.
प्रिंसिपल मैम को अनम्यूट कराइए सर.
हाँ प्रिंसिपल मैम, आप पहले अनम्यूट कीजिए अपने आप को ना.
Sir, is it okay? राकेश सर. ओके, प्रिंसिपल मैम का भी कोई वॉइस नहीं आ रहा है सर हमारे पास. प्रिंसिपल मैम को अनम्यूट करा दीजिए सर. आ जाइए. आ जाओ.
महेश्वरी सर भी आ गए हैं.
अच्छा, महेश्वर सर जुड़ चुके हैं. यस सर. ओके सर, प्रिंसिपल मैम के वॉइस नहीं आ रही है सर. मैम ज्वाइन कर रही है सर. ओके, उनका वॉइस आ रहा है सर. हमारे पास वॉइस नहीं आ रहा है मैम का, तो हाउ कैन आई स्टार्ट.
उनका माइक्रोफोन ऑफ है मैडम का.
सर उनका अनम्यूट करा दीजिए. आइदर फ्रॉम योर पार्ट और फ्रॉम मैम पार्ट. ओके सर.
मैडम की कनेक्शन में कुछ इश्यू है हितेंद्र जी.
यस सर, लग तो रहा है सही. ओके, वेलकम.
मैम अभी रिज्वाइन कर रही हैं, वो शायद कॉल आने की वजह से डिस्कनेक्ट हो जा रहा है उनका. तो आप स्टार्ट कीजिए, मैम भी आ जाए.
Welcome to all. Our program will begin shortly. It will take near about 1 minute. As we sort out our technical problem, we will start up our program.
हेलो.
Yes, ma'am.
हेलो.
हाँ जी मैम.
जी जी मैम.
हेलो.
आपकी
हाँ सुनाई.
Yes, ma'am. आपका वॉइस आ रहा है क्लियर.
अच्छा अच्छा, ओके. राकेश जी स्टार्ट करें प्लीज.
Yes.
हेलो.
Yes.
मैम सुन पा रहे हो आप?
हेलो.
Yes, ma'am. मैम आपका वॉइस आ रहा है क्लियर हमारे पास में.
अच्छा.
As we are going to start our program, so please mute your phone or your computer. Good afternoon, everyone. I extend a warm welcome to all the guests and the participants of this Professor B.N. Dhawan Memorial Lecture Series on recent developments in health and disease, which is being organized by Department of Geology, Pandit Lalit Mohan Sharma Government PG College, SDS Campus Rishikesh. Today our agenda is how we can make up our health, and that would be free from disease. So for this lecture series, Dr. Rakesh Kumar did a lot of job with each and everybody. They have discussed a lot of things with us. What would be our procedure to tackle such type of disease that in recent times we are facing our COVID-19 type of disease, which a pandemic disclosed by WHO. So what would be our mode of action for such type of disease? I would like to invite convener of this lecture series and professor in geology department for the formal welcome of all the guests and the participants of this webinar. Professor Rakesh Kumar, please sir. In recent times, we are facing our COVID-19 type of disease, which a pandemic disclosed by WHO. So what would be our mode of action for such type of disease? I would like to invite convener of this lecture series and professor in geology department for the formal welcome of all the guests and the participants of this webinar. Professor Rakesh Kumar, please sir.
Dr. Rakesh, you're not audible at all.
Hello.
Maybe you can directly speak in the computer if you don't mind.
Hello. Hello.
लोग अपने आप को म्यूट कर दें प्लीज.
Please mute rest of the peoples. Hello. Hello. Adi. Hello. 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 Hello.
Rakesh ji, you are not audible at all.
To neuropharmacology.
Hello.
And introduce modern concept in pharmacology related to teaching and drug research. For the early drug discovery and development, he set up several test system and animal model at CSIR CDRA Lucknow, which are being followed in several institutions and accepted by WHO. He conceptualized the research program for advanced studies on traditional medicines and headed the ICMR Center for Advanced Studies on Traditional Remedies at CSIR CDRA Lucknow. These contributions earned him an coveted fellowship of the International College of Neuropsychopharmacology, International Union of Basic and Clinical Pharmacology. Professor Dhawan served as a Senior Commonwealth Medical Fellow, London. He served as a visiting professor to several foreign universities, consultant of the committee member of IUFAR, United Nations Industrial Development Organization, WHO, UNESCO, etc. Committee chairman of the many committees of the Ministry of Earth Sciences, Environmental, Health and Family Welfare, Human Resource Development, Petroleum, Chemical, Department of Science and Technology, Scientific and Industrial Research, Biotechnology, Ocean Development, and Council of several CSIRs, Board of Directors, and public-private sectors of pharmaceutical undertakings. Professor Dhawan published over more than 400 research papers, obtained 20 foreign and 32 Indian patents. He had written 20 books, several prestigious awards, namely Third World Academy of Sciences Award in Medical Sciences, D.N. Prasad Memorial Award of Indian Council of Medical Research, and K.P. Bhargava Memorial Medal, and Dhanvantri Prize of Indian National Science Academy, etc., and many more were conferred on Dr. Dhawan. Besides the above outstanding qualities, Professor Dhawan was a great human being and a man of high ethical value. He will always be remembered for his numerous valuable contributions to science and society. On behalf of our organizing committee, I welcome eminent speakers and participants on this virtual platform at Rishikesh. We are indeed honored to have your online participation in this online series of talks hosted by Department of Zoology. We are being joined by many eminent speakers, participants joined from different universities, institutions, and colleges, making our program a true success. On this very important occasion, it is indeed a privilege to welcome Professor M.C. Trivedi, ex-director, Higher Education Uttarakhand, Professor N.P. Maheshwari, ex-director, Higher Education Uttarakhand, Professor Alok Dhawan, Director, Center for Biomedical Research, Lucknow, as our guest of honor. We thank you, sir, for adjusting your busy schedule to accommodate our request. I express my gratitude and welcome to Professor Kumkum Rautela, Director, Higher Education, Uttarakhand. Ma'am, thank you for your kind blessings and participation. I heartily welcome Dr. Ramdas Chatterjee, former Deputy Director and Head Department of Tumor Virology, Chittaranjan National Cancer Research Institute, Kolkata. I thank you, sir, for accepting our request to deliver an inaugural lecture on role of viruses on human cancers. I would like to extend my sincere gratitude and thanks to all the eminent speakers who are going to deliver their talks in this lecture series. Professor Akshay Anand from PGI Chandigarh, Professor Pankaj Seth, NBRC Manesar, Dr. Somnath Singh, Defense Institute of Physiology and Allied Sciences, New Delhi, Dr. Piyush Goyal, Department of Biotechnology, Government of India, Professor Rasmi Singh, Department of Zoology, Banaras Hindu University, Professor Musaid Rizvi, Department of Biological Sciences, Jamia Millia Islamia, New Delhi, Professor H.S. Jain, Department of Microbiology, University of Mysore, Dr. Ankita Punetha, University of Kentucky, to organize this online lecture series, of which will provide a platform to academicians, researchers, and students to participate and to interact with the speakers. Though this lecture series we aim to bring recent knowledge and awareness about various healthcare issues, individual and community healthcare to strengthen ourselves and live a long, healthy life. I express my sincere gratitude to Professor Sudha Bhardwaj, our respected principal ma'am, and chairperson of this program, who has been a constant source of encouragement and support in all creative and innovative activities occurring in the college. She believes in creating milestone, and it is in her efficient leadership that this college is leaping towards new heights in various academics and extracurricular activities. Once again, I would like to thank all of you for attending the virtual online lecture series. We hope that during the program, we all experience thought-provoking presentations and lively exchange of views. I wish everyone a successful and fruitful program. My personal respect and thanks goes out to all of you. Thank you very much for being with us. Dr. Hitenji, please. Encouragement and support in all creative and innovative activities occurring in the college. She believes in creating milestone, and it is in her efficient leadership that this college is leaping towards new heights in various academic and extracurricular activities. Once again, I would like to thank all of you for attending this virtual online lecture. We hope that during the program, we all experience thought-provoking presentations and lively exchange of views.
Thank you. Can you hear me?
Yes, ma'am, please.
Respected Chief Guest, Professor E.P. Dhyani, sir, Vice Chancellor, Sri Dev Suman University, Professor Kumkum Rotela, Director Higher Education Uttarakhand, distinguished guests, colleagues, students, participants, good afternoon. It is my pleasure to welcome all of you. I cordially welcome Professor Alok Dhawan, son of Professor B.N. Dhawan. He is the Director of Indian Institute of Toxicological Research, Center for Biomedical Research, SDPGI, Lucknow. He founded the Nanoscience Society in 2007 and is a fellow of National Academy of Sciences, fellow, the Academy of Toxicological Sciences USA, and many more. He has, to his credit, more than 150 publications and also won several honors. I again welcome you, sir. Our chief guest today, Professor P.P. Dhyani, sir, and our director, madam, are both unwell, but they have extended their good wishes for the lecture series. Thank you, BC, sir, and director, madam, for your kind blessings. I also welcome Dr. Trivedi, sir, and Dr. Maheshwari, sir, both former directors of Higher Education, Uttarakhand. Professor B.N. Dhawan Memorial Online Lecture Series on Recent Developments in Health and Diseases is being organized by the Department of Zoology, Pandit LMS Government Postgraduate College, Rishikesh. It aims to give recent developments and knowledge about communicable and non-communicable diseases. Professor B.N. Dhawan was a great neuroscientist, Director, Central Drug Research Institute, Lucknow, and past President, Indian Academy of Neurosciences, Indian National Science Academy, and Indian Pharmacological Society. On behalf of the Pandit Lalit Mohan Sharma Government Postgraduate College, Rishikesh, I welcome all the speakers and participants on this virtual platform at Rishikesh. I sincerely welcome Dr. Ramdas Chatterjee, former Deputy Director and Head, Department of Tumor Virology, Chittaranjan National Cancer Research Institute, Kolkata, for accepting our request to deliver the inaugural lecture. I would like to thank all the speakers who are going to share their valuable knowledge in this lecture series. I congratulate Professor Rakesh Kumar, who is the brain behind organizing this lecture series, and his colleagues in the Department of Zoology. We hope during the program we will get recent knowledge and awareness about various communicable and non-communicable diseases. I wish for a grand success of the platform. Thank you.
Thank you, ma'am.
Thank you, ma'am. As without your support, this webinar series would not be our chief patron, the director, Higher Education, will provide this webinar series due to some health problems. So, on behalf of her, she has sent me get a chance, Professor Trivedi, to share some words of blessing.
Yes, I'm getting your voice. First of all, I would like to thank my colleagues of the Department of Zoology, Government PG College Rishikesh, for organizing such a program that we can hear the eminent professors of the different universities and different colleges all over India and all over the world. Now today, I was told by Dr. Rakesh Kumar in the forenoon, I can say, to join this meeting, and I'm very much delighted and feel honored that you called me here. I wish you all the success for this program. Thank you.
Thank you, sir. Thank you very much.
It means a lot, sir. Now I would like to
थैंक यू। आज जो ये कार्यक्रम आयोजित किया जा रहा है पंडित ललित मोहन शर्मा गवर्नमेंट पीजी कॉलेज ऋषिकेश के द्वारा, उसके लिए, उसकी सफलता के लिए मैं हार्दिक शुभकामनाएं, और आपको निमंत्रण दिया उसके लिए मैं आपका आभार व्यक्त करता हूं। ये वास्तव में एक बहुत ही फ्रूटफुल रहेगा ये सीरीज, और बहुत ही महत्वपूर्ण टॉपिक पर ये सीरीज आयोजित की जा रही है। तो मैं समझता हूं कि सभी पार्टिसिपेंट्स इससे लाभान्वित होंगे। और अंत में मैं पुनः आप सभी का आभार व्यक्त करता हूं इस कार्यक्रम में, इस सीरीज में शामिल होने के लिए जो आपने मुझे अवसर प्रदान किया है, उसके लिए बहुत बहुत आपका धन्यवाद। थैंक यू वेरी मच।
थैंक यू सर।
Thank you very much, sir,
वीडियो ऑफ
for
है,
your kind words
वीडियो
and
ऑफ
the
है,
blessings you have showered upon us.
वीडियो ऑफ है। समझ? हाँ
I would like to introduce
हाँ जी
our
बेटा।
तो ऑफ क्यों दिखा रहा है?
guest of speaker, Professor Alok Dhawan sir. Professor Alok Dhawan is currently a director, Center of Biomedical Research Technology. Previously, he served as director CSIR, Indian Institute of Toxicology Research in Lucknow, and outstanding professor biological sciences, candidate scientific and technical research unit. He also served as a director CSIR CDRI Lucknow from I think December 2017 to July 2018. He was the founding director of Institute of Life Sciences and Gene Management in Ahmedabad University, Gujarat. He was paid and instrumental in building institutions of excellence in transplantation institutes and national laboratories across the world. He obtained his PhD in biochemistry from University of Lucknow in 1991 and was awarded BSc by the University of Bradford, UK in 2017. He has visited several countries both for conducting research as well as to deliver some lectures at scientific meetings. Professor Dhawan developed several areas at CSIR, IITR, namely genetic toxicology, in vitro toxicology, alternative animal model in toxicology, in silico toxicology, and non-medical toxicology. Apart from an innovation ecosystem, he started the area of nanomaterial toxicology in India and published the guidance of document on the safe use of nanomaterials. As a mission director, he steered a CSIR mission node program of food and consumer safety solutions that named as FOCUS, involving several CSIR institutes to provide technological solutions from farm to fork apart. From the National Research Institute, from the apart from the National Research Institute and Research Center for the of the FSI. He has been instrumental in establishing direct biofinance and DSIR CRDPH at CSIR IITR to promote entrepreneur. Professor Dhawan has won several honors and awards, including the INSA Young Scientist Medal in 1992, CSIR Young Scientist Award in 1991, the Shakuntala Anuchan Prize of ICMR in 2002, award lecture in the field of toxicology by National Academy of Sciences in 2008, the Vigyan Ratna by the Council of Science and Technology in 2011, Lucknow University Alumni Association Award 2016, Professor S.S. Katyar Endowment Lecture 2019, the Indian Science Congress Association. He founded the Indian Nanosciences Society in 2007. In recognition of his work, he has been elected Fellow of the National Academy of Sciences, India, Fellow of the Academy of Toxicological Sciences, USA, Fellow of the Academy of Environmental Biology, Fellow Academy of Sciences and Animal Welfare, Fellow National Academy of Human Sciences, President Society of Toxicology India, Vice President Environmental Mutagen Society of India 2006 7. He has his credit more than 150 publications and 20 books of reviews, chapters, 7 patents, 6 copyrights, and he has edited 9 books. Now I would like to
Thank you so much for this very elaborate introduction, I would say. At the outset, let me say how thrilled our family is that the institute, your LMS government postgraduate, this very noble gesture, and I think I'm very delighted that we've got a very distinguished speaker today, Dr. Ramdas Chatterjee, who is the former head department of Virology from CNCI Kolkata, who will be delivering his talk today. I think for any scientist, the greatest tribute is to have something in his honor pertaining to science. So I think Dr. Rakesh was with him in CDRI, and he is very befittingly honored his guru. At the same time, I feel that it is an honor for this family to be, in a sense, honored by the college in Rishikesh and remember my father in this way to organize a lecture series during the COVID time. I think we would have been thrilled had he been here, and I must congratulate the organizers and thank everyone who's behind this thought process. I should also like to thank and congratulate Dr. Ramdas Chatterjee ji, who has taken out time on a Sunday afternoon to be with us and share his knowledge. So from our side, I wish all of you the very best for this entire lecture series, and once again thank Dr. Rakesh, Madam Principal Ji, and the entire college to have decided to have a series in my father's name. Thank you so much.
Thank you, sir. Thank you very much.
Denji, you are muted. You need to unmute.
Thank you very much, sir, for your kind introduce gesture Rakesh group. So each and every person in the research area or candidates should show this type of gesture to their gurus, so that the next coming generation can take an example of showing their gratitude and their gesture to such a guru. Okay, now I would like to introduce our invited speaker, Professor Ramdas. Dr. Ramdas Chatterjee did his PhD and MSc in PhD in biochemistry from Calcutta University. He received a postdoctoral fellow at the University of Pennsylvania and University of Pittsburgh, USA. For 30 years, he conducted research in cancer biology at various capacities in Chatterjee National Cancer Research Institute, Kolkata, and superannuated as the head of tumor virology department. He guided several students for PhD degree and conducted research projects as principal investigator, get extramural funding from ICMR, CSIR, IBT, National Institute of Health USA, International Council for Research on Cancer Conference, World Health Organization, EIUNET, and Indian Council of Social Science Research. He published 52 research papers in peer-reviewed national and journals. He also acted as a visiting scientist at the University of Pittsburgh, USA from 1999 to 2008. He also served as a guest faculty at the microbiology department of Lady Bowden Medical University. Presently, he is the president of KK Chatterjee Memorial Association, a non-government association. With this brief introduction, I would like to invite Dr. Ramdas Chatterjee to kindly deliver his Chatterjee speech.
Thank you, sir. Let me try to get my slides.
Yes, sir.
Is my slides visible to all?
No, sir. No.
Can you all see my slide?
No.
No, sir. Not yet, sir.
This time?
No.
No, sir.
Now,
Just open.
Sir,
Sir,
you
open.
have to share your screen, sir.
yes. Let me see. Are you getting it now?
Yes.
Visible slide?
Yes, sir. Yes, sir.
Yes, sir.
Is this slide full screen?
No, it's not full.
No, sir.
No. Yeah, I have done the presentation. Then the slides are here, but I have to make it full screen. Is it full screen now?
Yes.
Okay, I welcome you all to this lecture series. This is lecture series in the name of our renowned person, Dhawan, and PhD Professor Dhawan, as he is an industrial scientist. I also thank the organizers for giving me this opportunity to present them. So to start with the role of high risk cancer for us, I request try to give an overview summary. So all the association of high risk institutions. What sort of association is there with high risk? We call the high risk institutions. High risk must represent and push the cell towards cancer. Out of the many tumor viruses, there are Epstein-Barr virus, hepatitis B virus, Kaposi Sarcoma virus, human papillomavirus, and mantle cell carcinoma virus. By the way, marker cells are precursor cells, which is essential in the skin to give the right touch sensation. Then RNA tumor viruses, there are retrovirus like human T-cell lymphoma virus and human lymphocytic viruses like HLA-B and hepatitis C viral RNA viruses. So this is the picture whenever we introduce a virus. You can see the different proteins that are associated at the core of the virus. There is RNA of the virus, and there are phosphosynthetase, then there are other enzyme
स्लाइड नहीं आ रही ना
स्लाइड उनका वीडियो पिन हो गया है
Hello?
सर आपकी
Hello?
सर आपकी हाँ नाउ से
Is it okay?
not
Can you hear me?
Everyone else should mute their mics because there's a lot of disturbance coming out.
Can you hear me now?
Yes, sir, we can hear you.
Okay. So there are different proteins, core proteins are there. Then there at the very outside there is a lipid bilayer. Then there is a protein, one is large protein GP120, glycoprotein 123 adultin. Then there is GP41, which is attached to the membrane. There are matrix proteins and all.
slides
Which one? Slide. Slides are not visible, but this is the full screen now.
Sir, actually, you have to stop sharing and share again. Somebody in the middle, actually, Aftab shared his stream.
Oh, okay.
If you just stop sharing and share again, sir, it will come back.
Okay, it will come. Let me try.
Thank you.
Is it visible now?
yes
Is it okay? So the virus, when it enters the cell, at the outside of the cell, there is a receptor, CD4 receptor, then the HIV virus gets attached to the receptor, then enters into the cell, then the virus has its own RNA that is changed to DNA, then viral RNA and the host cell DNA are coupled and the double-stranded DNA is formed, which is entering the cell nucleus, which is integrated into the cell genome, and then there is transcription, and outside the nucleus in the cytoplasm, the viral RNA is leaving from the nucleus, and then there is protein formation, translation of the protein, then virus proteins are formed in the cytoplasm, and ultimately the virus is coming out at the bottom of the cell, so new virus is produced from the cell. So the virus is utilizing the machinery of the host cell to reproduce itself and to produce more viruses. The cells grow and divide in a controlled way to produce more cells. So there will be a controlled way, actually in the normal, become damaged or changed, producing mutations, and that will affect the normal cell growth and the cell division.
These extra cells thus formed, they may form a mass of tissue, and this mass of tissue is called the tumor or cancer. In the above half portion of this picture, you can see formation of cancer. Then there is normal cell division. You can see the normal cell. Ultimately, the apoptosis or programmed cell death is there. This is the normal cell. So all normal cells have to undergo apoptosis or programmed cell death. But in case of cancer, the programmed cell death or apoptosis is absent. There is formation of uncontrolled number of cells, and these cells together will form the tumor mass. So what is causing cancer? Cancer arises from the mutation of the normal gene. The normal gene is mutated to become cancer. The factor which brings about the mutation is called a mutagen. The mutagen causes the mutation. It is thought that several mutations are required to give rise to cancer. The mutated genes that cause cancer are called the oncogenes. Until 1961, it was not known that genome in the variants of RNA tumor viruses was RNA, and they were named retroviruses following the discovery of reverse transcriptase in these retroviruses in 1970. So retroviruses use RNA as genetic code and have reverse transcriptase in them. To reproduce, they change these RNA genes into DNA, and some of the new DNA genes become part of the chromosomes of the host cell, and these leads to cancer. So three basic groups of retroviruses are, one is oncoretroviruses, which are causing cancer. Then there are slow retroviruses or lentiviruses, which cause severe immunodeficiency. And there are foamiviruses or spumaviruses, which are benign and not linked to any disease. Retroviral genome contains three basic genes: gap, pol, and envelope, in the order of 5' to 3' direction. So this is the genome of HIV. You can see there's a long terminal region in the upper left hand side, and there is another LTR on the right hand extreme side also. There are U3R, U5 in the LTR region. Then there are GAG, POL, and N genes, major genes. Then there are several small genes, VPR, VPU. All these are producing small proteins, which are very important activities in the viral pathogenesis. And ultimately, there is reverse transcriptase also. So this is the genome of HIV-1. So long terminal lipid is required for integration of the RNA into the host genome, and the LTR contains the regulatory sequences. GAG gene encoding structural proteins, all gene encoding different enzymatic activities, and envelope gene encodes membrane proteins. Few of the viruses like Epstein-Barr virus and Kaposi sarcoma herpes virus, they infect a cell and persist as circular episomes of plasmids, replicating separately from the host cell DNA. Oncoviruses induce sarcomas, leukemia, lymphomas, and mammary carcinomas. So viral genes that transform the cells are called the oncogenes. Oncogenes of different classes cooperate among themselves to produce more pronounced oncogenic effect. C-onc are the mutated form of the proto-oncogene of the normal cell, and the C-onc can cause tumors. And V-onc or viral oncogenes, there is altered cellular genes of the RNA tumor-inducing retroviruses. So viruses cause cancer by either inducing accumulation of genetic mutations or expressing oncoproteins that modify cell survival and proliferation control of the cells. Two modes of virally induced tumors are there. One is acutely transforming and another is slowly transforming. In case of acutely transforming, the virus particles carry a gene encoding overactive oncogene, that is V-onc. An infected cell is transformed because of the V-onc. But in slowly transforming case, virus genome is inserted near a proto-oncogene in the host genome. Viral promoter or other transcription regulation elements then cause overexpression of the proto-oncogene that induce uncontrolled cellular proliferation. As chunks of viral genome insertion near the proto-oncogene is slowly transforming viruses have long latency period compared to the acutely transforming viruses. So unlike DNA tumor viruses, RNA viruses target proto-oncogenes rather than disrupting the tumor suppressor functions of the cell. After being transformed, host cells acquire the ability to invade tissue and metastasize to distant locations. Some viral proteins induce secretion of enzymes that favor cell migration and decrease cell-to-cell adhesion and allow cancer progression. Some viral proteins inhibit metastatic suppression proteins and or alter level of cell adhesion molecules like integrin and matrix metalloproteinases. So here are some viruses at a glance which are causing cancer. Hepatitis B virus and hepatitis C virus causing hepatocellular carcinoma or liver cancer. Epstein-Barr virus can cause Burkitt's lymphoma, Hodgkin's lymphoma, post-transplantation lymphomas, and nasopharyngeal carcinoma, and in some cases of gastric carcinoma. Human papillomavirus, the high-risk type, can cause cervical, anal, or penis cancer. And there are some instances where head and neck carcinomas are also associated with human papillomavirus infection. HTLV1 virus is associated with adult T-cell leukemia. HIV virus can cause non-Hodgkin's lymphoma and other types of cancer. Kaposi sarcoma associated herpes virus can cause Kaposi sarcoma, primary effusion lymphoma. Viruses is Merkel cell virus that can cause Merkel cell carcinoma, which is a very rare skin cancer. Certain other viruses have been thought to be associated with brain tumors. Out of them are BKV, JC virus, and also HG40. Human T-cell leukemia virus or HTLV1 was the first human retrovirus that was isolated. About 2 to 5% of the HTLV1 infected patients get lymphocytic leukemia and non-Hodgkin's lymphoma, which is called adult T-cell leukemia anemia. Why some people get leukemia out of these infections while others don't? There is no certain reason for that. There is no cure for HTLV1 and the infection remains lifelong. HTLV1 can spread same way as HIV, but it cannot cause AIDS like HIV. HIV-1 is not a direct cause of cancer. Infections. The cancer caused by HIV-1 can be Kaposi sarcoma, non-Hodgkin's lymphoma, especially central nervous system, and cervical cancer. Excepting transmission virus or TTV and the same viruses, all other hepatitis viruses are named with a letter of the alphabet. Although hepatitis viruses cause similar disease, but they are varied in origin as they are distinct. For a long time, there were only 3 types of hepatitis viruses: HIV, hepatitis A1 virus, which caused infectious hepatitis, and there was HBV, which caused serum hepatitis, serum that was used to prepare vaccine used against yellow fever was contaminated with HBV, and that's why it was called serum hepatitis. Then there was hepatitis non-A and non-B, which are not responsible for neither the A virus nor the B virus. But HCV, hepatitis C virus, causing the non-A non-B hepatitis was discovered in 1989, much Hepatitis virus nature you can call HAV virus, which does not have any envelope. Its genome is positive single-stranded RNA, and the transmission is fecal oral route. Hepatitis B type virus has envelope, and it is a partially double-stranded DNA. It is transmitted through blood and sexual activities. Hepatitis C virus also has envelope. It is also single-stranded RNA virus. It is transmitted through blood and among the user drug users. Parenterally, it is transmitted. Sexually also, HCV is transmitted. HDV has envelope. It is a negative sense RNA virus. It is transmitted through blood. HEV has no envelope. It is positive sense RNA. Transmission is fecal oral route. HGV has envelope. Again, it is positive sense RNA transmitted through blood. Same virus. Positive sense viral RNA is similar to RNA, and immediately it is translated into host cell DNA. Negative sense viral RNA is complementary to mRNA, so it must be converted to positive sense RNA first and RNA polymerase before transcription. Purified RNA of a positive sense virus can directly cause infection. Purified RNA of a negative sense virus is not infectious by itself, as it needs to transcribe into positive sense. HBV has a circular genome, partially double-stranded DNA. It is complete full-length strand with approximately 20 square. HBV do not possess integrase activity. Is 10 times more prevalent than HIV infection worldwide. Hepatitis B virus has 4 partially overlapping open-ending frames that translate into 7 proteins. Core around genome contains 2 proteins, hepatitis core antigen and hepatitis E antigen. Viral DNA polymerase or reverse transcriptase protein, hepatitis C, hits of COVID-19 are all associated with the genome.
हेलो
माइक्रोफोन ऑफ है
किसका नाम है मे बी द इंटरनेट
हाँ इंटरनेट की दिक्कत है
सर मे बी द इंटरनेट इशू हेलो
I think there is some they are going to rejoin us soon. Rakesh sir, please contact Professor Chatterjee sir.
ओके श्योर सर सर आपका डिस्कनेक्ट हो गया है जी
Rakesh sir,
ओके प्लीज प्लीज नो प्रॉब्लम
Chatterjee sir.
ओके ओके श्योर नो प्रॉब्लम सर प्लीज Dr. Chatterjee is trying to reconnect again very soon.
I'm not getting your voice sir.
Dr. Dr. Chatterjee is trying to connect again.
Connection
Dr. Chatterjee is trying to reconnect again very soon. Dr. Chatterjee is trying.
Is there any connection problem with
Yes,
Professor Chatterjee?
yes. He's trying to complete
Okay,
that.
he's trying, sir.
Yes.
Okay. Is there any connection problem with
Yes,
Professor Chatterjee?
yes. He's trying to complete
Okay,
that.
he's trying, sir.
Yes. सर क्या प्रॉब्लम होगी? ओके ग्रेट. Please. No problem. Please, sir. Yes. Okay.
You are saying something?
No.
Okay.
Yes.
Chatterjee sir, are you getting my voice? Please unmute yourself, sir.
हितेन जी पूछिए. हितेन जी. सर चटर्जी सर. हितेन जी बात करें, हितेन जी।
Is my slide visible?
Yes.
Yes, sir. Now you can start, sir.
Is it okay now?
Yeah,
Yes,
please.
sir.
Okay.
Please continue.
So as I was talking that hepatitis B virus has 4 partially overlapping open reading frames that are translated into 7 proteins. The core around the genome contains 2 proteins. One is hepatitis core antigen, another is hepatitis E antigen.
Yeah.
The viral DNA polymerase, that is the reverse transcriptase, protein kinase C and heat shock proteins are all associated with the genome. Hepatitis B virus is divided into 4 major serotypes: ADR, ADW, AYR, and AYW, based on antigenic epitopes that are presented on its envelope proteins. And it is also divided into 8 genotypes, A to H, according to the overall nucleotide sequence variation of the genome. The genotypes differ by at least 8% of their sequence from one to another. From A to B, there should be at least 8% difference in the nucleotide sequences. Hepatitis A virus is most of the outbreaks of this virus are sporadic and associated with contaminated food and water. Average incubation period is 30 days. That means the development of the symptoms take 30 days after infection. Jaundice occurs in 70 to 80% of the
एक मग
individuals
लाके ना
infected.
वहाँ डाल देना।
मैम, मैम प्लीज अपना फोन माइक्रोफोन स्विच ऑफ कर लीजिए, म्यूट कर लीजिए मैम।
Hello.
Yes, please, sir.
Can you hear me?
Yes, please, sir. Continue, sir.
Sir, please continue, sir.
Yes. So hepatitis B virus is major spread from mother to infant. That is the transmission mode major. And high risk groups like those who are taking intravenously blood users, they are also good transmitters.
Yes, please, sir.
And in case of dialysis patients also, the transmission is there. Persons with multiple sex partners are also transmitting the virus. Healthcare workers in the hospitals are also good transmitters. So average incubation period for hepatitis B virus is 80 days. The symptoms are same as in case of hepatitis A virus infection, but with addition of joint pains. That means hepatitis B virus infection brings joint pains in addition to all symptoms that are shown by hepatitis A infection. About 30% of these patients show no symptoms. 30% show no symptoms. Chronic infection cause cirrhosis of liver. Chronic infection of hepatitis B, cirrhosis of liver, and some of these may also develop hepatocellular carcinoma, HCC. Death from liver disease occurs in 15 to 25% of chronically infected patients in case of hepatitis B. 20% of hepatitis surface antigen positive mothers pass the infection to their children, offspring, at the time of birth. And the risk of transmission is 90% if mother is also having hepatitis E antigen. So the symptoms like fatigue, abdominal pain, loss of appetite, nausea, vomiting, darkening of urine, and jaundice. These are the symptoms of the viral infections. Of to hepatitis surface antigen, S antigen, or hepatitis core antigen. During window period, when there is virus in the body, but there is no showing of antibody, this time anti-hepatitis core IgM is the only serological evidence of the disease. The blood test for liver enzyme like aspartate aminotransferase and alanine aminotransferase also helpful because in case of liver damage, these enzymes are also shortfall is there. Viral genetic material like RT-PCR or PCR can be done to diagnose. Anti-hepatitis B surface antigen, these are the common test, indicates previous exposure to hepatitis B virus. And hepatitis surface antigen, the protein antigen, is the earliest indicator of acute hepatitis B and identifies infected people before symptoms appear. So about hepatitis B vaccine, there are 3 doses series. First after 1 to 2 months after the first injection, then 4 to 6 months after the first injection. So these are the 3 dose series. No maximum time between doses, no need to repeat the doses if it is missed or restarted. There is 2 dose series for the adult dose. It is for 11 to 15-year-old people. Infants may be vaccinated at birth. Protection is given for to 30 to 50% if only 1 dose is taken, 75% if 2 doses are taken, and 96% if all the 3 doses are given. The protection is lower in older people and among the suppressive illnesses. Then there is Engerix B recombinant vaccine produced by GlaxoSmithKline. There is Recombivac's vaccine HB produced by Merck. There is Comvax, which is along with hepatitis influenza type B virus vaccine. Then there is Twinrix vaccine, HAV and HBV, both are there marketed by GSK. Pediatrics against hepatitis B virus, tetanus, pertussis, which is whooping cough, and polio. This is pediatrics against HBV. 95% of vaccinated individuals are protected from hepatitis B virus infection. Most of the infected people, almost 2/3, are unaware of their infection, and the silent infection is the biggest threat. Many people are getting infected without knowing that they are infected. Hepatitis C virus is an RNA virus and does not integrate into chromosomes. Hepatitis C infection prevalence is 1 to 2% of the world population. Transmission routes intravenous drug users, parenteral route, there may be during body piercing, perinatal transmission, the rate of infection is about 6%. It may be higher, about 17% if there is co-infection with HIV. HCV infection in majority cases, has mild acute disease. Complete recovery is possible in only 20% cases. 80% of the infected people may progress to asymptomatic chronic infection, and 20% may develop cirrhosis of liver. Chronic infection of HCV sometimes progress to hepatocellular carcinoma without the intervening period of cirrhotic stage. There is no effective vaccine against hepatitis C virus. Persons with hepatitis C should be vaccinated against hepatitis B to prevent co-infection with hepatitis B. About 10% of the patients with chronic hepatitis B virus also are co-infected with HCV. HCV has a single-stranded positive sense RNA virus, 9.4 kbs per length. Its open reading frame encodes a polyprotein precursor of 3010 amino acid length, and there is a 5' untranslated region flanking ORF is 341 nucleotide long UTR and well conserved in almost all isolates of the HCV. The 3' UTR is highly divergent, it can vary, and of varying length. There are 10 functional proteins coming out of the ORF. The viral RNA genome considered as viral mRNA, and it is translated by host cell without the help of complementary RNA intermediates. HCV do not need an RNA transcriptase packaged into the virion. HCV is classified into 6 genotypes with several subtypes of about 80. It can be diagnosed by ELISA method or reverse transcripted PCR, or stitch-based rebar recombinant immunoblot assay, or line immunoassay. These are the methods of diagnosis of the HCV infection. Then about human herpes viruses, there is HSV1, herpes simplex virus 1 and 2. Most of the genital herpes are associated with HSV2, and there is cold sore, eye infection are caused by HSV1. Varicella zoster virus is also called HHV3 type. It causes chickenpox and shingles. But Epstein-Barr virus, which is the HHV4, these can cause Burkitt's lymphoma, nasopharyngeal carcinoma, and mononucleosis. Cytomegalovirus, which is hepatitis herpes virus 5, it can cause mononucleosis. Herpes virus 6 is human herpes virus 6 variant, two variants A and B. They can cause roseola in the young children. Then there is herpes virus 7, which is having the same effect as HHV 6. HHV8 or carcinoma Kaposi sarcoma herpes virus, this is associated with Kaposi sarcoma, a rare type of skin cancer. This is herpes virion. I will pass on because I lost time. So there is HSV1 and 2. HSV1 infection occurs in mouth and pharynx, cause genital herpes in 10% cases. HSV2 infection, mostly 90% of the genital herpes cases are associated with this, and this is transmitted through sexual transmission. HSV2 infection most common in people aged 20 to 30 years. Infected people shed the virus even at asymptomatic condition. Infection can be stopped by practicing safe sex, that is using condoms. Many of the infected people do not know about their infection, either because doctors do not recognize the symptoms or they never suffer from any type of symptoms. Most people, more than 90% of world population get EV infection at some point in life. Children in developing countries are infected immediately after antibodies in mother's milk begin to wane. Mostly, these infections are asymptomatic. Latent infection remains for life. The cancers that are linked with hepatitis Epstein-Barr virus are Burkitt's lymphoma, nasopharyngeal carcinoma, or cancer of the upper throat, Hodgkin's or non-Hodgkin's lymphoma. Then there is T-cell lymphoma, and there is cancer of the soft tissue, which is called leiomyosarcoma. The first human virus directly implicated with human tumors is EBV or Epstein-Barr virus. It is transmitted primarily through saliva, through kissing, sharing drinks, eating utensils, and the incubation period for EBV is 4 to 7 weeks. The infection and replication occurs in epithelial cells of the nasopharynx. It spreads to B cells, and Burkitt's lymphoma is a solid tumor of the B lymphocytes. Though 95% population of developing countries are infected with EBV, all of them do not develop Burkitt's lymphoma, as it happens to those only who suffer from weak immune system, like chronic malaria or AIDS. They only get the Burkitt's lymphoma. Kaposi sarcoma associated herpes virus is cause Kaposi sarcoma, cancer of the blood vessels, and two types of lymphoma. Those with weak immune system get the cancer from KSHV. Kaposi sarcoma is rare, slow-growing cancer appearing as reddish, purple or blue-brown tumors underneath the skin. In Kaposi sarcoma, cells that line blood and lymph vessels are infected with the virus. They divide too much and live longer and eventually turn into cancer cells. Kaposi sarcoma virus infection is lifelong, as with other herpes viruses, but does not cause disease in most healthy people. The virus spreads during sex and through blood and saliva. Epstein-Barr virus and Kaposi sarcoma virus harbor large linear double-stranded DNA genome and preferentially infect B lymphocytes and epithelial cells. Due to powerful transforming potential, Epstein-Barr virus infection in some cases lead to development of lymphomas and non-Hodgkin's lymphoma and also carcinomas. Virally encoded latent membrane protein of EBV, the LMP1, is mediating the oncogenic potential of Epstein-Barr virus. These are the several types of tests that are done for diagnosis of herpes virus infection. This table shows the test, virus culture, sometimes DNA test mostly, some are serological tests, and the specimen used are blood or sometimes skin lesions to diagnose the infection. Merkel cell virus or polyomavirus has a circular double-stranded genome similar to other human polyomaviruses. Usually it does not cause cancer, MCV. Only in some cases it causes a rare skin cancer, Merkel cell carcinoma. Constitutive expression of small and large T antigens upon viral integration results in the virus-induced transformation, thus making it an etiologic agent of Merkel cell carcinoma. Harold Jurhausen first shows that HPV, human papillomavirus, can cause cervical cancer, and he claimed this in 1974. Later on, it was shown that different types of HPV existed by 1977. About 50% of sexually active men and women acquire the genital HPV infection in their lifetime. By age 50, 80% of the women will acquire human papillomavirus infection. Majority of the 200 types of human papillomaviruses cause no symptom. Some types cause, in only minority cases, cancer of cervix, vulva, vagina, or anus in women, or of anus and penis in men. Human papillomavirus can also cause pre-malignant or malignant cervical lesion. Among the high-risk types of human papillomaviruses are 16, 18, 31, 32, 35, 51, 51, 57, like that. And the low-risk types are 6, 11, and 42 mainly. In addition to persistent infection with high-risk type human papillomaviruses, other cofactors like cigarette smoking, carcinogen benzopyrin enhance development of the cancer. Human papillomavirus, particularly high-risk types, are also associated with 20 to 60% cases in tumors of oral cavity, larynx, tonsil, conjunctival carcinoma, and anogenital carcinoma. There is no productive in vitro system for papillomaviruses, so the research on papillomavirus is suffering because of that. HPV has a double-stranded circular DNA genome of about 8 kilobase long. All protein encoding sequences of the virus are on one DNA strand, and the genome has 3 segments: LCR, upstream regulatory region, a long control region. Then there is early gene that occur early in virus life cycle. Then there is late gene that occurs late. Genome consists of 8 open reading frames, E1, E2 to E6, E7, L1 and L2. So there are 6 early genes and 2 L1 and L2 are late proteins. The different ORF, E1, E2, and all that, they have different functions. I'll skip this slide to save my time. So this is the genome structure, 8 kilobase long. So how it causes cancer? Cancer development upon persistent infection with high-risk type of human papillomavirus is mainly attributable to expression of oncogenes E6 and E7 of the virus. E6 and E7 proteins bind to P53 and PRB anti-oncogenes or tumor suppressor genes, block their function, and enhance the process of carcinogenesis. Such inhibition results in the accumulation of genetic lesions associated with carcinogenesis. Integration of HPV DNA into host genome increases transcript stability and helps expression of E6 and E7 genes. Integration causes deletion of cellular sequences, alteration of proto-oncogenes and chromosomes like deletions, duplications, translocation, etc., and thus the process of carcinogenesis is enhanced. Virus is essential for initiation of the process of carcinogenesis, but it is not essential for maintenance of the tumorigenic phenotype. While integrating viral DNA breaks at E1, E2 region site, and breaking at these locus disrupts the control over E6, E7 proteins, resulting in overexpression of these ORFs like E6 and E7. Serum antibody to capsid proteins have neutralizing effects, but they play no important role once the viruses enter the cell. Cervical keratinocytes immortalized by HPV 16-18 have reduced production of interleukin 6 or 8, granulocyte macrophage CSF, tumor necrosis factor alpha, which all are needed for host immunity. By direct contact with skin and mucosal surfaces like vaginal, oral, and anal sex contact, HPV can transmit. Non-sexual transmission of 6 and 11 to conjunctiva and nose have been reported. HPV colonization of neonatal oropharyngeal cavity is common. Only clinically expressed HPV disease acquired at birth is respiratory papillomatosis, which are growth of numerous vertigoles in larynx of the vocal cord. I'll skip this. So how the infection, papillomavirus infection detected by electron microscopy, you can see the virus. By serology, morphological methods are there. Human immunohistochemistry can be done to show the presence of viral antigens. Then you can test the presence of HV DNA in the tissue by PCR, habit capture method, southern blot method, in situ hybridization method, filter in situ hybridization, rod blot hybridization. I have no time to go into detail of all this. Most infections are temporal. 70% of the infections of the women go away in 1 year and 90% in 2 years. So even if infected, the women don't, most of the women clear the infections of human papillomavirus of their own. Persisting infection in only 5 to 10% of women and of high risk type lead to invasive cancer in 15 to 20 years. So only women who are having this persistence infection, they are only 5 to 10%, they only may get the cervical cancer. They will definitely get it, that it doesn't make sure, but they may get, they are in high risk to get the cancer, and that also take long time, 15 to 20 years. Approximately 1% progress to invasive cervical cancer. The discrepancy may be due to other cofactors. Why is it that so many people are infected, but most of them are not getting the cancer? That is because absent of other cofactors, such as smoking, other infection agents like chlamydia, herpes, bacterial vaginosis, parity, use of oral contraceptives, and host immune factors. All these play a great role in causing cancer associated with human papillomavirus infections in the cervix of women. Though there is no treatment to cure HPV infection, no antibiotic or drugs to kill the virus, the infection often clears on its own about within 2 years. Of Gardasil, which is covering HPV 6, 11, 16, and 18. So this is a quadrivalent vaccine. There is another vaccine, Cervarix, marketed by GSK, GlaxoSmithKline. It's a bivalent. It works only against human papillomavirus type 16 and 18. Both these viruses elicit virus neutralizing antibody responses when given these vaccines are given. Vaccines can prevent cervical cancer, precancerous cervical lesions, vaginal lesions, vulvar lesions, genital warts, oropharyngeal, and head and neck cancer caused by human papillomavirus. Gardasil 9 is a 9-valent version of the vaccine, and it covers strains responsible for 20% of cervical cancer, like types 31, 33, 45, 50 to 58, and this was approved for individuals aged 27 to 45 years. Vaccination against HPV is recommended for males and females before adolescence and beginning of sexual activity. The vaccine has to be given before the start of sexual activity. Vaccines given intramuscularly in 3 doses. Second dose is given after 2 months of the fast, and third is given after 6 months of the fast. So 3 doses to females aged 9 to 40 years. The vaccine cost 8,500 approximately for Gardasil and 6,000 for Cervarix. The protection again by having this vaccine lasts for at least 10 years with the Gardasil 9, and with Cervarix is 6 years. So this is time variant is there, what type of vaccine you are taking. Vaccine is not recommended for pregnant women. Gardasil is currently tested in men also, including gay men. Cervarix may provide sustained antibodies of HPV 16 and 18 for 20 to 50 years. I will skip these 2 slides. Then diagnosis and therapies I have already mentioned in brief. So the therapies for virus-associated cancers, antivirals are given. Ganciclovir is given for Kaposi sarcoma virus, entecavir, telvibuddin, and tenofovir for hepatitis B virus infection. Nucleoside or nucleotide inhibitors are for hepatitis B virus and C virus. Vaccines, Engerix B and Santavrivac for hepatitis B, Gardasil, Cervarix for HPV. Then there is chemotherapy for Kaposi sarcoma and Merkel cell polyoma virus. Drugs like salicylic acid, imiquimod, podophylox, and trichloroacetic acid are given for HPV wards. There are steroids for Epstein-Barr virus infection. Surgical and radiation therapy are there for Kaposi sarcoma, hepatitis B virus infections, human papillomavirus and polyoma, and Merkel cell carcinoma virus. Protease inhibitors are there, boceprevir, telaprevir for hepatitis C virus, and other therapies like highly active antiretroviral therapy for AIDS patient and Kaposi sarcoma, transplantation of allogenic and hematopoietic stem cell is possible. Then there is CHOP chemotherapy for HTLV1. CHOP meaning cyclophosphamide, hydroxydonomycin, doxorubin, and oncovin and prednisone. These two all together is called CHOP. So you all know by now the viruses that are causing cancers. Thank you for your patient hearing, and I'm sorry for the disturbance in between, technical disturbance beyond my control. Thank you very much. Hello.
Hello. Thank you very much, sir.
Yeah, I'm sorry.
It's all right, sir.
So much of disturbance.
So, I would like to thank Professor Chatterjee for enlightening us with such a vast knowledge and wonderful talk about this basic information on the role of viruses in human cancer and its diagnosis. Now the session is open for questions. If any one of you has any question, you can come up with it. Any question?
Sir, may I ask Dr. Bipin Chand Pathak? He's from Government Postgraduate College, Pithoragarh. He just put a question in the chat box that vaccination of the cervical cancer safe or not. Sir, may I ask Dr. Bipin Chand Pathak?
Yes.
Have you got my?
We are not getting your voice, sir.
Okay.
Sir, getting my voice?
No, I'm getting yours. Yes, sir, please. Okay.
Yes, I can hear you.
Okay. Sir, the one Dr. Bipin Pathak, he's asking regarding the vaccination of cervical cancer. It is safe or not?
Rakesh, you're not audible.
Okay, I'm sorry. Yes, sir, please. Okay. Sir, okay. Dr. Bipin Chand Pathak is asking vaccination of cervical cancer safe or not?
Not receiving your voice.
Still.
You're not getting my voice?
Not audible.
No, sir.
Sorry.
Ramdas sir, your voice is okay, sir. But
Okay.
Rakesh sir voice is not okay.
Dr. Bipin Chand Pathak is asking vaccination of cervical cancer safe or not?
Not receiving your voice.
Still.
Okay. Now we got forward for this.
Thank you, Dr. Chatterjee.
Is there any question from the participants? Okay. Okay. Beyond the protocol, I would like to invite again Professor Alok Dhawan sir for their final words on the program as a son of a great personality in the field of research. So Alok Dhawan sir, please give your some words.
Thank you, Eten. I think I thank profusely Professor Chatterjee. I think he gave a very befitting talk today, and I honestly say that there were a lot of things that I did not know earlier, which I came to learn from his talk. I think he had positioned the talk in a way that even students can understand, apart from young faculty, and also a lot of things about not only about the virus but about diagnostics also. I was very intrigued to see even the pricing is mentioned. So I think this only goes to show the depth of knowledge that he has in the subject, and he has put it up in a very lucid manner, in a very simple manner, so everyone can understand. So I think, Professor Ramdas, I think I need to thank you profusely that you gave a very wonderful talk. And I must also mention that my son, who's the younger one, who's first year undergraduate, he was listening to your talk as well, and he could understand. He said it's a fantastic talk. So I must convey my greetings to you and my good wishes that you have been presenting such a simple way that everybody could understand. And once again, I thank Rakesh, who has decided to start this series in my father's name. I think it's a very befitting tribute to him. And I think it's a very noble gesture on part of Rakesh.
Thank you.
So thank you once
sir.
again, Rakesh, and thanks to your college management for agreeing to it. Thank you very much indeed. Thank you.
Thank you very much, sir.
Okay. Thank you, Dr.
I think it's a very noble
You all
gesture
will
on
be sent
part
the
of
feedback
Rakesh.
on your
Thank you
mail,
once again,
and
Rakesh, and
after
thanks
filing it,
to
you
your
will
college
receive your
management for agreeing
certificates. Now, I would like to invite the organizing secretary of this webinar, Dr. Preetpal Singh, to come forward and present his vote of thanks. Dr. Preetpal Singh, sir, please. Please unmute yourself. Please unmute yourself.
Thank you, Dr. Eten. I hope you all have a very good evening. On behalf of the organizing committee and audience, I would like to give my hearty vote of thanks to our speaker, Dr. Ramdas Chatterjee from Chittaranjan National Cancer Research Institute, Kolkata, for making an excellent presentation and making this lecture series a very meaningful and interesting. This lecture was very wonderful and informative. Thank you, sir. I would like to thank our guest of honor, Professor Alok Dhawan, son of Professor B.N. Dhawan and Director IITR, Lucknow, for gracing today's lecture. Thank you, sir. And I also like to thank our Chief Patron, Professor Kumkum Rotela, Director Higher Education, Uttarakhand, and Professor T.P. Dhyani, Vice Chancellor, SDS, University Tiri Garhwal, for their blessings and support. And also my special thanks to Professor N.P. Maheswari sir and Professor M.C. Trivedi sir for their blessings. I would like to express my deepest gratitude to the patron Professor Sudha Bhardwaj ma'am, Principal Government PG College Rishikesh, for her guidance and moral support. I would like to thank our beloved Professor Rakesh Kumar sir, convener, and Dr. Hitendra Singh, organizing secretary, to arrange such a wonderful lecture series and beautifully organized. I am happy to express a vote of thanks to our participants from the various organizations. Thank you so much for your cooperation. Thanks to all. Now, Dr. Hitel, please.
Thank you, Dr. Singh. I would like to apologize for this technical default. We are in the process of building the digital India. So we have different type of situations occurred in front of us, as some things are not in our hands or some are out of our control as government. So please cooperate with us. Now, next Sunday at the same time, 4
Sir, please.
Where this webinar goes in the coordination of our
Yeah.
Professor and Ramdas sir.
Sir, thank you very much, Dr. Hitenji. And thank you very much, sir, Dr. Chatterjee, sir, for such a informative talks. And I would be grateful for your kindness to accept our request and deliver a talk for our audience. Thank you very much, sir, for your kindness. And thank you, all of you, for joining us with this program. And this program will continue till 2-3 months. And I would request you all, please join the next Sunday at the same time. The title has already been given by the Dr. Hitenji. So thank you very much for you all. Thank you very much for your participation. 2-3 months, and I would request you all, please join the next Sunday at the same time. Okay, sir. The title has already been given by the Dr. Hitenji. Now it's closure, please. Thank you very much for you all. Thank you very much for your participation. कैसे बंद हुआ था कैसे आप होगा चलो ओके
Call option.
Yeah.
This one.
Now it's closure, please. Yes, okay. Oh my God. Thank you. That was great.
Amazing.
Thank you.